Dear colleagues, it is a very great pleasure to be here to deal about how to prevent and manage running injuries in athletics. I would like to thank the organizers for invitation to talk about biomechanical issues. I'm Pascal Edouard, professor in physiology and sports medicine at the University Hospital of Saint-Étienne in France. In athletics, about 3/4 of athletes experience an injury during a season, and the majority are during running disciplines, with this main diagnosis, especially hamstring muscle injuries. Focused on injury occurring during international athletic championships, for which we have important and representative database. About 90% occur during running disciplines, and about half of them are lower limb muscle injuries. Analyzing specifically these lower limb muscle injuries, we reported here the number of injury according to the disciplines and reported according to the required running velocity, so presenting from sprints to marathons. So there is a decrease in this running speed from the left to the right of this graph. You can see important number of injury in sprints and lower for long distances, with majority hamstring injury. In this figure, this is the percentage of injury according to the discipline. So you can see an important percentage of hamstring muscle injury for short distance and high velocity disciplines, and higher percentage of posterior lower leg muscle injuries for long distances and lower speed running. So there seems to be a shift with increase of hamstring muscle injuries with increase of speed, and increase in posterior lower leg muscle injuries with decrease of required speed. So this presentation will more focus on sprint running disciplines and hamstring muscle injuries. Looking specifically at the running biomechanics, this experimental study in laboratory setting explores the contribution of lower limb muscle for the running speed and its propulsion, with different way of analyzing EMG, biomechanical 3D model. They reported that the contribution of ankle muscles were higher for lower velocities, and contribution of hip muscle was higher for higher velocities. So there was a shift in the muscle contribution with the increase of speed from ankle to hip. So running injury risk reduction should be specific to the required running velocity. Looking specifically at sprint running mechanics and hamstring exercise, and specifically about EMG activity. These two studies reported the EMG activity of hamstring during sprint, and this is a reference at 100%, and different exercise reported to be used during rehabilitation and prevention. And none of this exercise activate hamstring as high as sprint. So sprinting was the only exercise able to activate hamstring muscle as high as sprinting. And as so, sprinting could be considered as part of the solution for hamstring injury risk reduction. Looking at sprint running biomechanics, the sprint acceleration performance determinants is the horizontal force production, the ability to produce high amount of horizontal force in the forward direction. So, and the muscle determinant of this horizontal force production are mainly hamstrings. We thus analyze the potential association between this horizontal force production and the occurrence of hamstring injury during one season prospective cohort study in football players. They had several horizontal force production analyses over the season with hamstring injury data collection. And we reported a significant association between the horizontal force production and the hamstring injury occurrence, hamstring injury, which occurred just after the evaluation. So this study reported the association between a low horizontal force production and a higher risk of hamstring injury within the few days or weeks after the test. Regarding sprint running kinematics, these case-controlled studies in football players reported that players with previous hamstring injury have an anterior tilt of the pelvic compared to control football player without hamstring injuries. We can thus estimate that the anterior tilt position could be a risk factor of hamstring injury, and so sprint kinematics could be a risk factor of hamstring injuries. In this randomized controlled trial, athletes in the intervention group performed a specific program which changed significantly the tilt position, so it is possible to change the tilt position with the program. Regarding the rehabilitation of hamstring injuries, this randomized controlled trial in semi-professional football players reported that the players who have a global, multifactorial, and criteria-based progression for the rehabilitation had a lower risk of recurrence of hamstring injuries, with the same delay for return to sport with an increase in sprint mechanics parameters. So rehabilitation and probably also injury prevention should be multifactorial with criteria-based progression targeting running velocity. In general, for injury reduction and management, it is important to think at the context, be global, multifactorial, and target the individual athletes, to be specific to athletes' individual deficiencies. Take-home message of this presentation: the function creates the organ. So rehabilitation, management, prevention should target the organ, and as such should be sport-specific, plurifactorial, repair and rehabilitate, increase the capacity of the tissue, not negligent pain, train appropriately. Thank you very much for your attention.